Sen Maquad District Hamilton Donjaba, Maquad Dodo. My colonial name is Henry Evans Tenbury. I'm a CUPE 7800 retiree, and I'd like to give a special thumbs up to CUPE.
To introduce the Executive Director of the Ontario Health Coalition, Natalie Mera. So many of you know her, and I just want to say that this woman has been working tirelessly for years and years and years in coalitions, with coalitions across this province. And she's here to tell you the lay of the land, what we have to do, and what we will do to win this victory. Thank you, Natalie. A round of applause. Thank you, Caroline.
49 of 59 local ambulance services, 12 of 22 local ambulance dispatch centers. They are imposing real dollar cuts on our public hospitals and our long-term care homes. And in addition, as if that's not enough, they're planning to cut 2 special funds for long-term care homes. This amounts to a massive offload of hundreds of millions of dollars to municipalities who either have to cut the long-term care and public health services or raise municipal taxes in order to maintain those services. It amounts to a significant impact on our local public hospitals, already funded at the lowest rates in Canada, already bursting at the seams with patient overcrowding rates that are not seen anywhere in the developed world. We have the fewest hospital beds left of any province in Canada after 25 years or more of hospital downsizing. We cannot take any more hospital downsizing in this province. It has gone too far already. And our message to Doug Ford today is, Ontarians voted for what you said that you would do. You said that you would end hallway medicine. You said that you would improve mental health care. You said that you would expand long-term care. What Ontarians thought that you were saying was that there would be more, not less, not the most dramatic cuts that we've seen in decades. Ontarians voted to improve public health care. There is no mandate in Ontario for these cuts. There is no mandate for this government of listening more while cuts continue to march across our province and offload costs and suffering onto patients and onto care workers all across Ontario. The choice cannot be between the first terrible plan and the second only slightly improved.
Under some very difficult and dangerous times with this new premier. A premier that seems hell-bent on gutting public services. He seems determined to take everything that is good about the healthcare system in Ontario and turn it inside out. Ontarians sicker. People will die. That is the truth. We cannot sugarcoat it. We cannot cover it with anything else other than we cost share of 75 to 25. And now they want to reduce it even more, 60 to 40. Deferral, softening, canceling. They are not investments in new services. All he's doing is deferring the cuts. A cut is a cut. Cuts. Stop Ford cuts. Stop Ford cuts. Thank you very much. Time for us today. Please welcome them very, very strongly.
Good afternoon, friends. My name is Dr. Raghu Patel. I'm an emergency room physician along with an opioid overdose. In 2019, this year, 144.
They say come back! They say come back! Are we ready to fight? Damn right! Are we ready to fight? Damn right! Are we ready to fight?
Agree with that? Yes, you do. Friends, at this time, I would ask health is very much an umbrella that we are all under. It is where we should be. We should be all under the same umbrella, fighting for the same rights. Friends, fight. Please remember, standing under that umbrella of public health is the most important thing we can do, and let's not forget our friends in education. Thank you.
To make them more resilient. What do you think, Doc? You think we're stupid? We're seeing this, we're watching it, and we're not going to have any part of this. So we just watched the last federal election, and the Conservatives knew that Doug Ford was a casualty in waiting. And so Andrew Scheer said, Doug, go in the basement, shut off the lights, hide in the corner, and shut up. But thank God Doug's not smart enough to do that. And because of you, Doug, the federal Conservatives won 5 seats out of 61 of the GTA, and I say thank ribbons that they are not going to form the government. The government would take $17 million out of women's programs. That leads to cuts in women's shelters for women who are suffering domestic violence. Who would do that? Our parents and grandparents out of bed, dressed, cleaned, into the breakfast table, 6 minutes. So Doug, you and I, long-term care facilities for 1 day. And if you have any sort of a conscience, you will stop your cuts immediately because our parents deserve so much better. So what you see today is happening all over the place. It's happening in 4 communities. People are standing, people are demonstrating, people are fighting because people are sick of you.
Represents 65,000 registered nurses, healthcare professionals and others around this province. And we have representatives.
We need solidarity, need solid air to breathe. We won't weep if we reap what we sowed. We believe giving each equal piece, that's the goal. We don't steal, we don't scheme. They see us as drones. Taking what's yours. Money, power, respect, what my people call it. I mean, we making all this money, they just keep it all it. As they got me putting rent up on my visa. Sky is the limit, they don't want to see us reach it. They want to keep us down. They want to keep it secret. The people, my leaders, elitists. I'm sick of broken treaties. I'm sick of how they treat us. The people, united.
Will never be defeated.
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 Make some noise, yo!
Thank you, both of you. That was just what we needed to keep this crowd